name is Dr. Cairo Kimende. I'm the patron of EquiHealth Global right here in Kenya and in Murang'a County. Today, we have invited members of the Dylan Jones Academy community to come and get assessed for their health. We are looking at a team of EquiHealth Global of about 12 members who are volunteers who've come here today to see patients, to see members of the community who might have health issues or who might just need a consultation or who might have dental issues. We are happy that about 100, so far we have treated 82, but about 100 people have shown up here today to get dental services. You can see the dental truck from the Kenya Dental Association. You can see our dentists, our clinical and medical officers, and our nutritionist, who is also here, and more volunteers, public health, and others who are here today to just make sure that our children in this community, our parents in this community, our teachers in the school, and other staff, and everyone basically who lives around this community gets treatment, gets to be examined on matters of oral health. We have seen a lot of children who, together with their parents, did not realize they had any issues with their teeth, only to find they need an extraction, they need replacements, they need refilling, they need cleaning or dental scaling, and all of that is happening here. We are just not doing serious cases. The ones that appear serious need referral. We refer them to Murang'a County Referral Hospital or Maragua Sub-County Hospital. But a lot of others who need extractions, who need scaling, who need cleaning, or who need education on dental and oral health have been assisted today, and they are quite happy. You would imagine people go to seek these services in the hospitals, but what we are finding is that they do not realize and they do not understand the kind of or the degree or extent of problem that they are facing with their oral health. So, for example, one child here, we've had to extract 2 teeth, and even elderly men who've been smokers or maybe have staining of their teeth or bad oral health have been seen here today. And a lot of them are appreciating that they never get to seek these services elsewhere. We are also doing clinical assessment. We've seen patients with high blood pressure. We've seen patients with diabetes, and quite a number of them are receiving their first diagnosis today. The others have been known to have or know that they are suffering from high blood pressure or hypertension and diabetes, but they've not been seeking medical services, and therefore we've given them, some of them, emergency medication. We've had to send some to the hospitals, especially the ones who are just able to walk in to tell us their problem, and then when we take their BPs, we find they are significantly elevated, not too high, but something that would be would benefit from common oral medications. We've seen a lot of them here. We have also seen other medical conditions. For example, we've seen a child with what we call bow legs or club foot, a combination of all of those, vitamin D deficiency, complications of birth. We've seen children with that. And even though that was not part of our agenda to deal with children living with disability or even to deal with the developmental conditions, we've had to handle them, because when you announce for people to come get checked for oral health, others show up that were not part of the plan. So we have to assist them, we have to educate them, we have to give them information that pertains to their health, and to advise them, proper advice on where they need to seek those services and when, especially now that we are approaching Christmas and some of these services might not be immediately available without booking. So we advise them, and they go, and we give them a small note so they go seek those specific services. We are also offering nutritional counseling in our activity or program today. We have a nutritionist who's been able to see quite a significant number of children with who are malnourished, maybe a few who might be overweight, depending on where they come from around this region, and to just advise them on a balanced diet, adequate diet, food hygiene, and all of that information that revolves around nutrition, because we understand healthy children, children who want to play and who run around, need to have their health status verified, checked, and that they be happy because they are guaranteed of good health. We are also offering today free Colgate and free toothpaste, small packets of toothpaste that we have here for those we consider are in need of urgent oral health and oral hygiene. We have that with us here, and we've been issuing for free to a lot of them. And we know and we hope they are going to use the education they've gotten here today, together with the toothpaste and the toothbrushes, to have a sustainable life of oral health. We are happy that we have been able, with the support of many other partners and the EquiHealth Global US, to be able to offer these services to see 100 children and parents and mothers, fathers, grandparents, teachers, staff, and members of the community here today. They seem to keep coming, even though our plan was to start at 8 and close at maybe 1 p.m. It seems it's already past 1 p.m. right now, and they are just seated here waiting for these services. This tells us that these services on oral health, nutrition, and general clinical checkups are really important. We need them, the people need them, and we have not, even as a government, we have not exactly been able to penetrate and provide sufficiently. There's still some work that needs to be done, and so partners like EquiHealth Global, partners like Kenya Dental Association are always welcome. There is work for all of us in the improvement of the health of the people and in the transformation of lives. This is about transforming lives for the people here. It's about changing lives, and it's about building the economy, building lifestyles that can be sustainable, providing meals for the children, especially here at Dylan Jones Academy, and providing education, and also providing health advice, health education that will enable these people around this community to be solid citizens that are able to provide for themselves in a healthy way, to change their own lives, and then to change the people they live with.
Ndĩ mũikari wa Kambirwa, ndĩ mũkenu nĩ kũreherwo ũtungata ũtarĩ marĩhi wa magego. Nĩ tũrathondekwo nginya andũ agima na ciana. Nĩ tũramunywo magego, nĩ tũraheo ndawa, ona nĩ tũrathambua magego. Na nĩ tũkenete mũno nĩ kũreherwo ũtungata ũtarĩ na marĩhi, tondũ thibitarĩ ĩrĩa ĩ hakuhĩ ndĩrĩ ũtungata wa magego. Ũguo mũndũ angĩbatara ũtungata wa magego no athire Murang'a General kana athi Marangwa. Tũrĩ akenu na nĩ twacokia ngatho. Nĩ tũracokeria ngatho andũ arĩa mokĩte na mũbango ũyũ, na tukauga Ngai amarathime na amongerere.
Kako na gum, kako na meno, kako na roof.
My name is Kelvin, and I'm a great friend to EquiHealth. Today we are here at Dylan Jones Academy, and we are really excited to see the work that the Lord has been able to do through EquiHealth, serving so many people, and especially seeing the young children here who have come to receive medical attention. Over 100 people have been served today, and this is really a good gesture. The dental camp, I think, has been the highlight of my day, because dental services in some parts of our country are very hard to find, and so the impact that the dental camp brings, or the dental clinic brings, is really rich and wide, and the partnership that EquiHealth is having with Kenya Dental Association is enabling services that initially would not be able to be offered at this level to be offered, and so that is really a huge impact. I'm also excited because we started partnering together with EquiHealth when we had our first medical camp in Kitui in honor of Dr. Celestine Wangari. And now we have come to see the work that they have been doing in Murang'a, and this is just marvelous. This is good work. This is kujitolea to the maximum. That's what we say in this part of the world. And so we are hoping to continue working together, to continue reaching to communities that are not served, to continue using ourselves as an agent of what God is doing amongst people. And we hope to continue being able to reach as many people as possible. So I'm really grateful to the EquiHealth team here, the amazing and the warm welcome that we got when we came here. Today we were just coming to just give you emotional support, but we will continue working together with you in this good work, not only in Murang'a but also in other parts of the country.